Hey, what's going on, everyone? I'm just about to go walk outside because I've been working all through my lunch. I need some fresh air, but I decided before I do that, I wanted to give you a tour of how our exercise area is set up here in our clinic because it's a common question that we get when we talk with doctors every week. They say, how much space do you need? How do you set it up? What kind of equipment? Does it have to be totally decked out and get all this fancy equipment, or what do you do? So I'm going to show you our exercise area. I'll give you a tour and I'll just explain as I walk through. Okay, so I'm backing up. This is our traction area in the background. So I'm gonna flip the camera around, and here we go. Okay, so as we walk in, let me stand back over here actually. So this used to be a one-way window, all right, because we did a little demo and we converted this room over. And instead of having it be a one-way window, like that one, that's inside my dressing room, we took the window out because we felt like it was easier to communicate and see our exercise therapists in our traction area. It made it more functional. And believe it or not, it used to be a wall here and doors. We knocked all this out. We actually have a video of how we did the demo in over like a long 3-day weekend. So why did we do a demo? Because on the other side of this wall, we had like a huge exercise area that we thought we needed all the space, and then we found out we didn't need all the space. So about, I don't know, early this year, the beginning of the year, I got a wild hair and decided to do some demo work. And over the course of a Friday, Saturday, and Sunday, we were open for business on Monday, and we converted it over, and this works just fine, actually even better. And it's not all that huge. So here's what we got. We have 2 Stroops power racks. Do you absolutely need these? No. Do you need something to anchor to a wall? Yes, this allows us to anchor, so it helps very well. So we have these, we like these, we like Stroops, we recommend Stroops. We have a bunch of elastics. All right, what are these? Elastic bands with a vinyl covering, very safe. They get a carabiner on both sides. You can attach them to a handle. You can attach them to like different sticks. We have a fancy schmancy Stroops one. Okay, awesome. We do our postural corrective exercise. There's a couple little functional exercises we do with these, but for the most part, that's as fancy as it gets. And then we have kettlebells. All right, a cannonball with a handle on it. So kettlebells, that's what we progress our patients to, is using kettlebells. We have a single mat table for our older patients or maybe a more acute patient that can't get down on the floor. We have these big area floor mats to designate where people are going to be doing stuff on the floor. And then underneath there, we have these smaller mats that if people need some more cushion, they can grab these. Okay, but if they don't need more cushion, they just set up shop and lay down on the floor. And in the very intro of this exercise area, patient walks in and they have sequence 1, 2, or 3. These are our functional movement warm-ups. They've been assigned. Are they doing 1, 2, or 3? Are they doing cervical, thoracic, lumbar, or a combination therein? And then we have our stack of all of our Move Well home mobility kit tools. So double the cross ball, neck trigger point tool, we got foam rollers, and over here on the wall we got J-canes, we got different flat bands, resistance bands, mobility bands, okay? And that's pretty much the main equipment we have here. We have a massage table that we have set up here because that's where we can do some manual therapy protocols with the patient. If we have to do more extensive testing, if we're doing a functional movement test in here, we use that table. Sometimes patients will use it to exercise on for protocols. All right. And then we have our board, exercise board. David already mapped this out for this afternoon. We're about to see some patients here this afternoon, and I don't know, I think we have close to 30 patients this afternoon, so this is mapped out, and then once patients start going through care and get wiped off the board, he'll fill out some more. We have all the exercise cards are pulled, and they're stuck in these vertical filing slots over here, and each one of those numbers correlates to a spot on the board. And these are our systems, and these are systems that we teach chiropractors inside of our Move Now University doctor training portal. And the systems is what makes this. It's not the equipment. Yeah, there's some equipment you need, okay? But the equipment is not what makes this. It's the systems, like the systems of patient engagement. We have belts up on the wall with these chalkboards. Call it belts, bands, boards. All right, we have all our white belt patients up there, and they are just chomping at the bit to get to yellow belt. And then less blue belts, because that's a little more advanced. green belts, orange belts, black belt. Whose name is up on black belt? We got my buddy Marshall, who's a Strong First instructor, owns a functional gym here in the area. We got Dr. Todd, me, black belt, and then Trainer Tony. And we have some other people that are destined to become black belt one day. Like David's in here working on something. David needs to be a black belt.
I want to. Let's do it.
Yeah, you want to?
Let's do it.
So David is newer to our team. Say hi, David.
Hey.
Okay.
How's it going?
And so David, I'll flip this around. David, we actually lucked out finding this guy because he is a physical therapy assistant, worked with physical therapists for over 3 years, and has a lot to offer. Coming into a clinic that already has all these systems, he dove in. You've gone through the majority of the stuff in Movable University as far as training, right?
Yeah.
And what's your take on it? Here, I'm gonna unplug my mic, so I'm gonna put you on the spot and have you just explain.
I think it is an excellent tool, whether you are familiar with it or not. If you take advantage of everything that they offer,
So I mean, like
everything we offer on Movable 3, you can quickly adapt it. I feel like it's easy to access.
Yeah.
And whenever I have questions in here, I don't have to always go to Dr. Todd.
Usually just find it inside the portal, right?
Videos and
Right. And now we've never had anyone quite like David before who just goes through it and like already knows everything immediately because he's been working in the rehab world for 3+ years and he's a personal trainer and that's just his background. However, we've had other staff that come in with little exercise experience. They go through it. They follow it step by step. They incorporate it the same way. It just takes them a little bit longer. But it's cool for the first time to have someone who's like a pretty seasoned dude out there be able to look through it and get feedback from them. And something that David now is helping us do is develop out some even more protocols. He's actually working on something right now, which is what? This is
I'm on the last page, yeah.
He's on the last page of the road, like mapping out strategically exactly what a projected exercise prescription looks like, visit by visit over the course of a 12 or 15 minute game plan for a patient, whether they're acute, exceptional, or what? We have like rigid. So like someone who's very rigid, someone who's super acute, or someone who's an exceptional patient. And then I'll flip this around again, because look at that, we have a treat. We have Dr. Zach and we have Brandy, office manager, who's always smiling.
Oh, hey.
Always smiling, doing the little peace sign. Right? Okay. Nice. All right. Let's see if there's anything I'm missing. I'm doing a tour of the exercise area. I just toured the exercise area. Look at that. We have a party here now.
You showed them the belts, right?
I showed them the belts, the bands, the boards, the kettlebells, the mobility kits, J-canes. Yeah, that's part of the mobility kit. All right. That's good. That's good. He's like, you talked about Matt, that basket over there.
We put our laundry, right?
Machine. Okay. So, and then also some PVC pipes. Those are helpful too for stick drills, teaching hip hinging. And that's it. So that's really what it takes to put this thing together, is that it's not, you don't have to have a ton of space. You don't have to have a ton of equipment. I mean, this is really not that much equipment. It's some pretty low tech equipment. I mean, it's not the equipment, it's the systems. And it's not the Davids either. You don't necessarily have to have Rockstar Davids. We just got lucky and got Rockstar David. You could have someone that doesn't know a ton about corrective exercise and they can learn it because we have all the training put together. Oh, the last thing you need is timers. Lots of timers. All right, so with that said, I'm gonna go take a walk and see some sunshine before we start seeing patients this afternoon. And make sure you check out a behind the scenes demo that we have. We have a pre-recorded demo and it is at demo.movenowU.com. You can watch a 30-minute pre-recorded demo behind the scenes inside the Doctor Training Portal and check out what that's all about. Reach out to us if you have any questions. We'll be happy to answer. And that is it. Over and out.